This video will illustrate for you in a step-by-step process how to administer your medication through an elastomeric device. The products that are seen in this video may differ slightly in terms of color or size than what you receive at home. Your clinician or home health agency nurse will demonstrate all of your supplies during your first few visits. If you ever have any questions regarding this video or your supplies, contact your pharmacy. The number is located in your patient packet that you received with your first delivery. Information about your catheter and medication administration. Let's start by familiarizing you with your vascular access device, which is also known as a catheter. In this video, the patient has a catheter in her arm, but it can also be in the chest. The catheter that is inside your vein travels to just above your heart so that the medication can be quickly pushed through your entire venous system. You will have a dressing over the area where your catheter has been inserted. Your nurse will be the one to change this dressing, usually once a week. Notify your pharmacy if this dressing is wet or coming off, and a visit will be arranged to change this dressing. You will be asked to observe this site daily to make sure that there is no redness or drainage from this site, and if there is, you will need to notify your pharmacy. It is important that you or your caregiver be able to give your medication as scheduled, which means that you likely will have an extension set attached to the end of your catheter. The length of this set depends on how long you need it to be to administer your medication safely. This extension set will be changed only by the nurse, so take care to not remove it. If you accidentally remove it, make sure your catheter is clamped and contact your pharmacy right away to have a nurse come and place a new extension set. At the end of this extension set is a small device that is referred to as an end cap or an injection cap. This cap is where you will attach your medication tubing or syringe. Do not ever remove this cap. At the end of this injection cap, you might see yet another small cap that is referred to as a swab cap. This is an extra measure to keep the end of your injection cap clean in between your medication times. You should have a sash mat in your folder in your delivery box, which outlines the steps to take and which supplies to gather when giving yourself your medication. SASH means saline, administration of medication, saline, heparin. And we believe it is easy to remember the steps by using these letters. If you don't have a sash mat, it is fine to do this procedure on a clean surface. Before you begin your infusion, you should clean your hard surface or sash mat, as shown here. If your medication is refrigerated, remove it at least 1 hour before administration and place it on the clean sash mat or surface area. Do not put this medication in the microwave or run warm water over the device to hurry up the process. Step 1. Washing your hands. To start with, you will need to wash your hands thoroughly for at least 20 seconds. Using soap and water or a disinfecting alcohol-based hand sanitizer if you don't have access to soap and water. When finished washing your hands, you will dry them with either a paper towel or a clean hand towel that is used only for this one time. Use the towel to turn off the faucet. Step 2. Your medication. You have removed your elastomeric device from the refrigerator and placed it on the clean sash mat or surface. Review the label on your medication. Make sure it has your name, the correct name of the drug, and the dose. Look at the expiration date. The medication should be clear and consistent in color and free of any visible particles. If any of these are incorrect or cause you concern, do not infuse and notify your pharmacy. Step 3. Your supplies. The sash mat will help guide you during this procedure. Now, gather your supplies, which include 2 pre-filled saline syringes, a heparin syringe, if this has been ordered, your room temperature elastomeric device, as well as 4 or 5 antiseptic pads, and a new swab cap. Take the wrappers off the syringes and place them on the sash mat, along with the medication. Place the antiseptic pads on the mat as well. Because you will be asked to rewash or sanitize your hands frequently throughout this procedure, it is recommended that you also have a bottle of hand sanitizer close to you during this process. So now, after you've gathered all the supplies needed, is the time to sanitize your hands. Step 4, preparing your syringes. Now you will prepare the syringes. Each pre-filled saline and heparin, if used, syringe has a cap on the end. To make it easier for you, the saline syringes have a white cap, and the heparin syringes have either a blue or a yellow cap. They are also clearly labeled on the side of the syringe. Hold the syringe upright. Loosen the cap on the syringe without removing the cap, and gently pull back the plunger of the syringe to pull in a small amount of air, and then push the plunger until a little bit of solution comes out from the top of the syringe. Now you can retighten the cap. This removes any air that might be in the syringe. Tighten the cap, and then repeat this with all saline and heparin syringes. Step 5, flushing your catheter. It's now time to flush your catheter. If there is a swab cap on your injection cap, remove it and throw it away. Then, open an antiseptic pad and clean the end of your injection cap vigorously for at least 15 seconds. For purposes of this video, we may not be demonstrating the full 15 seconds. Now, remove the cap from the end of the first saline syringe and attach it to your injection cap by pushing and twisting until it is firmly in place. Unclamp your catheter. Push the plunger on the saline syringe slowly, or you can use the pulse method to flush the catheter. To use the pulse method, push the plunger, pause, and then push and pause again until the syringe is empty. Do not force the flush. If you have resistance, contact your pharmacy. After you complete this flush, remove the syringe from the injection cap and throw it away as instructed by your nurse. Step 6, administer medication. You are now ready to administer your medication. Uncurl the tubing of the elastomeric device. Open another antiseptic pad and again, clean the injection cap vigorously for 15 seconds. Remove the end cap of the tubing and attach this to your injection cap and twist it until it is firmly in place. Once you have connected the tubing, then open the clamp on the elastomeric tubing. Note the time that you open the clamp, or watch the device for a few moments. Over time, it will begin to get smaller in size and feel softer, which means that it is going into your IV line. You can place this device in a pocket or a purse and go about your usual activities. The tubing controls how quickly the medication goes into your IV line. Once the preset time ends, the device should be empty. You will know the infusion has been complete when the device is flat in the middle. If there is still medication in the device, allow it to continue to infuse until the device is flat. Once the device is empty, clamp the tubing on the device and remove it from your injection cap, and discard the entire tubing set into your trash. Step 7, flush catheter again with saline and heparin. You will now flush your catheter with the next saline syringe, being sure to clean the injection cap again with an antiseptic wipe for 15 seconds. Throw the syringe away when the syringe is empty. If you have been instructed to do so, you will now repeat the flush with the heparin syringe. Again, cleaning the injection cap with an antiseptic wipe for 15 seconds. The heparin syringe has 5 cc's of solution. The label on this syringe will tell you how many cc's to flush. If you used the pulse method when flushing with saline, we recommend that you do not use this method with the heparin and just slowly push the prescribed amount of heparin into your IV catheter. Then clamp your IV catheter before removing this heparin syringe, and then throw the syringe away. You can now put on a new swab cap on the end of your injection cap. Congratulations! You are now finished with administering your medication with an elastomeric device. If you have more than 1 lumen on your catheter, there are more steps to take to be sure that you keep all lumens open and ready for use. To learn more about that process, please look at the video that is titled Catheter Care. We are available to help any time of day, any day of the week. Do not hesitate to call your local pharmacy with questions or concerns. This contact information is in your folder. You will also find resources at www.emeritaiv.com. We look forward to the opportunity to serve you.